This is Rainer Krahenmann. He'll be speaking on the new findings from the University of Zurich studies into the mechanisms of action of psilocybin and LSD research, a relevance for treatment of major depression and for enhancement of psychotherapy. I'd please ask if anyone from the past panel would take your conversation outside, please. Thank you. Dr. Rainer Krahenmann, MD, is head of the clinical research unit of the neuropsychopharmacology and brain imaging lab at the University of Zurich, an attending psychiatrist at the Department of Psychiatry and Psychotherapy and Psychodynamics at the Psychiatric University Hospital of Zurich. Dr. Krahenmann has led several neuroimaging and behavioral studies in the neurobiological and behavioral effects of action of psilocybin, LSD, and ketamine. Dr. Krahenmann works to advance understanding of the mechanisms of action of psychedelics, and he has recently been granted governmental funding for the first randomized, double-blind, placebo-controlled clinical trial of psilocybin treatment in major depression. Please welcome Dr. Krahenmann.
Thank you very much. The sound, this is good in the rows below? Yeah? Thank you. Hi, I'm Rainer Krahenmann. I'm from the University of Zurich, Switzerland. And today I'm going to present new data of our study. Next slide, please. Okay. So we have recently done a study and we looked at the effects of LSD on guided mental imagery. And what we found was that the effects were quite similar to dreaming, actually. And today I will discuss also the therapeutic potential of our results. Quite exciting. But first I would like to acknowledge our research and project study team. I would like to especially mention Franz Vollenweider. He's the head of our research group. I would also thank to our people from the lab and other people who are supportive and collaborative. Now, there has been an early mention that mescaline or LSD, since the discovery, might be very similar to dreaming. And this has been backed up by direct observation or subjective experience. You can see a picture from the 60s. It's a man during LSD, and he's wearing eye shades, which help him to focus into his inner experience. And as you can see from his behavior, from his smile, he might have a very blissful state at the moment. And it's very similar to dreaming, actually, and we try to elucidate that state. There's a famous book from Greenspoon and Beckler in 1979, and I just quote, "There are good reasons for applying the term oneirogenic, producing dreams, to psychedelic drugs. In its imagery, emotional tone, and vagaries of thought and self-awareness, the drug trip, especially with eyes closed, resembles no other state so much as a dream." Well, this is very interesting, and it has been further investigated also in the 60s and 70s. So what they did, there have been several studies done, and they gave LSD during sleeping or shortly before sleep onset. What they found in the early studies was that LSD enhanced dreaming and REM dream phases. So this kind of confirms this view. And it's interesting because both dreaming and psychedelics then kind of activate subconscious or unconscious material. They bring this material up to the conscious experience. And this is very interesting and also relevant, I would say, for psychotherapy. And so that's why I would like to talk about this. Now, going back to the ancient times, as you can see, dreams have been used since ancient times for spiritual but also healing purposes. On the left upper panel, you can see an Egyptian hieroglyph. It depicts a sleeping man, and he's lying there having dreams, and the Egyptians thought, well, during dreaming, the soul would leave the body. So the soul is depicted as a bird. The soul bird would fly towards the sky, and there it would meet God entities. It would then receive some kind of messages, maybe advice, maybe warnings, and flying back to the body and getting back the message to the dreamer. So these dreams were kind of prophetic dreams. And on the right-hand side, you can see another dream use, which has been the temple sleep in the Asklepios temple in ancient Greece. So the aim there was that if somebody was sick, both physically or psychologically, they would go to the temple, have an overnight sleep there, and being accompanied by priests. And during dreaming, they would get direct messages or healing dreams from Asklepios. Asklepios is the god of medicine. And by that, they would have a healing dream. The other possibility was that the priest just interpreted the dream, which they accounted later on, and they gave further advice. And then you can see another use of ancient dreams, which is the Tibetan dream yoga. Dream yoga is a very ancient technique. The goal there is to attain liberation, liberate the mind. So how is that made? Well, it's exercise to become lucid during dreaming. Lucid dreams. Lucid dreaming means while you are dreaming, you become aware that you are dreaming now. And by this, you get into a different state of consciousness. So you have a half waking state and a half dreaming state. And by this, you can control a little bit the dreaming action and decisions, and you also can gain insights. So by this, the ultimate goal would be enlightenment and liberation from the karma and from the attachments. So just a few examples of how dreams were used in ancient times. Now, modern research also shows that dreams may be very relevant for psychotherapy. There is a lot of research going on at the moment in terms of dream research and application for psychotherapeutic purposes. There are several mechanisms which might be useful for psychotherapy. One is simulations of future situations. So dreaming you can conceive of as a virtual reality environment, a natural virtual reality environment in your head during the night. And so what is happening there? The dreamer is confronted with difficult or relevant situations, and it can exercise these situations, and it can apply the learned knowing later on in the daily life. So that would be one possibility. And there's another application or mechanism, which is adaptation to social threat. It is understood that the brain has a kind of social threat mechanism in it, which is related to the limbic system. Emotions like fear and aggression are relevant to that. So if the brain is dreaming, social threat situations are occurring, and then the dreamer can confront that and exercise it and learn. And there's another possibility like creativity. Creativity is very interesting in terms of dreaming because creativity is a different kind of thinking. It's nonlinear thinking. That means you have one problem, one situation, and there are several lines of solutions showing up, and you can choose, and you can have a different perspective on the situation. It has been shown, for example, that if you want to solve a very complex mathematical problem, and if you sleep on that problem, you are better to solve it afterwards. It has been published in Nature 2004. There's another mechanism which is emotion-based learning. Emotions are very frequently activated during dreams. And what is happening there is that it's not just emotion, it's the correlated memory, which is also co-activated. And the memories are always in the context of the emotion and vice versa. And the memories are personally relevant. So that's why learning may occur during dreams. And finally, there's self-knowledge. For example, if you have insight into the roots of your psychological problems, if you gain this insight, then you might choose how to change the problem, how to behave better. Just a few examples. Now, how can we measure dreaming? It's not a very easy task, though, because dreaming is a very complex phenomenon. And on the left-hand side, you can see some neurophysiological measurements. So on top, you see the different sleep stages. There's the waking state, there's the non-REM sleep, the REM sleep. And in the middle, you can see during the night, you go through different sleep stages. You start from the waking state, you get drowsy, and then you go down to the deep sleep stage, which is stage 4 on the bottom. And then it goes back to a more superficial sleep stage, which is the REM sleep phase. It's the REM sleep phase, which is rapid eye movement sleep, because there it's when the rapid eye movements occur and when most dreaming occurs. So it's a neurophysiological correlate of dreaming. However, we have to know that dreaming is a subjective phenomenon. Dreaming is mental activity with vivid visual imagery and has got a narrative structure. So how can we directly measure dreaming? Well, we have to rely on the subjective reports of the dreamers. So how do we do that? One very standardized and formal measure, which has been used throughout dream research now, is cognitive bizarreness. Cognitive bizarreness is a marker for dreaming, and it has been used since the 80s. It was originally developed by Alan Hobson, and it relies on the dream reports. I will explain it later on a little bit in depth. Now, coming back to our hypothesis, and it has been mentioned or noted that psychedelic states and dreaming are somehow similar or comparable, but this has never been tested formally or systematically in an experimental way. And we did that. We tested the hypothesis that LSD states are similar to dreaming and the effects are similar to dreaming. So how did we do that? We used a randomized, double-blind, placebo-controlled trial in healthy subjects. And what we found was that mental imagery switched from thought-like imagery to dream-like imagery. So on the right-hand side, you can see the placebo condition. There, mental imagery was more like thinking. So it was rational, it was realistic, logical, just as you know it from your daily thinking. And then under LSD, it was more like dreaming. So it was more irrational, it's fantastic, bizarre also. So that's our main finding. I will come back to that later on. Here's the outline of my speech. First, I will talk about the guided mental imagery experiment. Then I will explain what is cognitive bizarreness, how is it defined, and how can we measure it. Then I will talk about the effects of LSD on cognitive bizarreness. And finally, I would like to explain or talk about the therapeutic implications. Now here's our guided mental imagery experiment. It's a standardized procedure which has been originally developed by Hans Carl Leuner in the 60s. And it goes like that. The subjects are requested to lay down comfortably, maybe in a couch, in a reclined position, and they are asked to focus on their breathing and to relax the muscles. So in order to get them into a kind of a meditative state, deeply relaxed state. And as you can see, subjects are wearing eye shades to help them to focus interiorly. And then the therapist instructs them to just imagine a scene. That can be a meadow, it can be a creek, a house, anything like that. And this is just a starting point. So that means going from there, from this original scene, the imagination is developed freely in an associative way. And the dialogue is developing, but kept to a minimum. So the patient or subject should develop his own images. And as you can see, there is a difference between dream reports and mental imagery reports. Dream reports are always retrospective because you have to wake up and then you have to report and you have to remember what you just experienced. That might be difficult or not possible. And during guided mental imagery, it's easy. You just talk and you get the reports and you can record it and That's what we did. We recorded, we transcribed it, and then we analyzed it for cognitive bizarreness. The whole experiment lasted about 30 minutes. Now, this is our study design. We used 3 drug conditions. The first condition, obviously, LSD, and then we compared it to placebo, inactive placebo, and we used the third drug condition here, which is quite interesting. We used ketanserin, pre-treatment of LSD. Ketanserin is a serotonin 2A receptor blocker. That means if you give ketanserin prior to giving LSD, it might be that it blocks the serotonin 2A receptors. However, we did not know how much that would change in terms of the effects. This is because first LSD has got also a dopaminergic part of action, and it has been shown that there are 2 temporal phases. There is an early temporal phase, which is more dependent on serotonin activation, and we've got the later phase, which is more dependent on dopamine activation. And also we know that dreaming might be closely related to dopamine system. So we really wanted to test the differential contribution of the receptor system to the effects. And on the right-hand side, you can see our primary endpoint measure, which was cognitive bizarreness gained from the imagery reports. So we had for each drug condition, we had a report, and we analyzed that. Now I will just explain what is cognitive bizarreness and how did we analyze that. As I said, cognitive bizarreness is a standardized measure of dreaming consciousness and has been developed by Alan Hobson. And the coding is a 2-stage procedure. So first what we did, we analyzed the reports for items which are bizarre. That means items which are physically impossible or improbable. And then we gave every item a code. Stage 1, A code would be a code, so it's a bizarre plot, a bizarre character or object or action. And then code B would be for thought, code C would be for feeling. And then there was a second coding stage where we reanalyzed the codes and gave another code. So it was code 1 for discontinuity, code 2 for incongruity, and code 3 for uncertainty. So in the end, we had a very differentiated coding for cognitive bizarreness. And here you can see our study results. On the x-axis, you can see the different cognitive bizarreness codes. You might want to focus on the total score, which is the main outcome here. You can see the 3 different colors. Blue is for placebo, yellow for ketanserin pretreatment, and pink for LSD. And on the y-axis, you can see the intensity of cognitive bizarreness in the reports. Now we have 2 main findings here. One is clearly LSD significantly increased cognitive bizarreness compared to placebo. But what we also found, and what was kind of interesting and also somehow surprising, was that ketanserin completely blocked the effects of LSD. So we can conclusively show that the effects of LSD on cognitive bizarreness are related to serotonin 2A receptor activation. Now we also wanted to look further into the data, and we did correlation analysis, and we looked into the relationship between subjective experience ratings for the altered state of consciousness. As you probably know, altered state of consciousness are normally rated using the Dietrich scale, the Dietrich altered state of consciousness scale, and we use that also. And we correlated it with the cognitive bizarreness change. So on the x-axis, you can see the change score for loss of self-boundaries and cognitive control. And on the y-axis, you can see the change score for cognitive bizarreness. So there was a clear relationship between the 2 measures. What does that mean? Well, self-boundaries is a very prominent concept in psychedelic research. It means in normal waking state, you have this duality between I, you, inside, outside, and so on. And during psychedelic states, these boundaries dissolve somehow. There are frequent reports of unity, of feeling connected to the nature, to the environment, to people, and this is very typical. And there's a second item here, which is cognitive control. That means in normal waking state, you kind of have a sort of cognitive control over your thoughts and your actions, and you can make clear decisions. And this is also impaired during psychedelic states. And so this concept was clearly related to the increase in cognitive bizarreness during LSD. What is interesting in this finding is that cognitive bizarreness increase is somehow related to aspects of self-processing and perception of self and others. So that might be very relevant also in therapeutic perspective. I just want to illustrate how this kind of change in experience of self-boundaries, cognitive control, and bizarreness was described by one of our LSD subjects. I quote, "I merged with the environment. I became one with all. It made me float around, and I no longer had a will to decide where I should go next. I felt that everything was happening without my volition. At one moment, everything wound around me like a plant. And then I went into the core of the plant. And suddenly I somehow emerged within an air bubble that was spat out of a volcano. I was me, but somehow also not me. And then I was flowing down the volcano as a lava stream." So that nicely shows the relationship between dissolution or loss of self-boundaries and control and bizarre imagery. Now I would like to go over to the conclusions. Well, first we found that LSD increased cognitive bizarreness, which is the dreaming marker. We also found that cognitive bizarreness was related to the loss of self-boundaries and cognitive control. And there was a major finding that LSD effects on imagery were dependent on serotonin 2A receptor activation. So we can finally conclude that LSD induces dreamlike imagery. Now, what is the relationship to the therapeutic application? How does this relate to that? Well, first, I would say we can conclude that cognitive bizarreness might be a good predictor for therapeutic outcomes, and we should really investigate that in future studies. And second, we can conclude that the combination of psychedelic treatment with guided imagery might enhance the therapeutic outcome of psychotherapy. But how does that work? Actually, we can go to a micro level of therapeutic process, and we can see that psychedelics activate dreamlike mechanisms. As you can remember from the first slides, there is activation of certain dream mechanisms like creativity, self-knowledge, emotions, and so on. These are all processes which are also activated by psychedelics. However, how does that translate into a therapeutic effect? Now, when there is a psychotherapeutic process going on, and if there is a therapeutic effect, somehow at some time point there has to be a change, a psychological change. How can then that be understood? Well, just take a neurotic depressed patient on the left-hand side. This patient has a fixed mindset. So he's entrapped in his mind prison, and he's constantly looping around his negative self-view and anxiety. And then somehow there's a therapeutic progress going on, and there's a shift in the mindset. So the mindset is going towards a growth mindset. What does that mean? Growth mindset is the liberation of this prison. That means there's more self-confidence, there's empowerment, there's a positive attitude towards future achievements and challenges. And that might be a very relevant mechanism to get into a healthier psychological state. Going back to the initial slide, yes, we can confirm that psychedelics induce dreamlike states of consciousness, And we can add that it might be important to enhance psychotherapeutic processes in this perspective. Finally, I would like to acknowledge our national and international collaborators. I would like to especially thank our funding agencies, which are Swiss National Science Foundation, Swiss Federal Office of Health, Usona Institute, Swiss Neurometrics Foundation, and the Hefter Research Institute. On top, you see our recent paper, which is being published in April this year, and which describe this study which I just talked about. Thank you for your attention.
If you have any questions, you can come up and use this microphone.
Hi, yes, that was a great talk.
Thank you.
I have a quick question about what you mentioned with the LSD and the dreamlike state, where it's different, the serotonin versus the dopamine. And I was wondering, is that a function of the metabolites, or where does that process take place?
Sure. Well, we looked at the receptor level of effects. So as you know, the brain has got several neurotransmitters and several receptor systems. And there are major receptor systems, and one is serotonin system and dopamine system. There are others, so we did not look into others. But these are the major systems related to dreaming and related to psychedelics. And before we did the study, we did not know whether the dopamine system would be important into these effects, because unlike psilocybin, for example, in LSD, the dopamine system is more strongly involved. And so we wanted to test the different effects. So that's why we use that. It's not at the intracellular level or something like that. Yeah.
Thanks for presenting, Dr.
Thank
Krahenmann. I'm interested in the dosage level that you were working with, whether there was some sort of a threshold at high dosage versus low dosage, even microdose levels.
You mean whether a different dose would have had a different effect or result, or?
Right. If maybe a low dosage LSD were led one to more logical behavior than irrational behavior,
Right.
Or that the dosage, that the irrationality was linearly or logarithmically affected by the increase in dosage.
Right, I understand. Well, actually, we used quite a low dose, 100 micrograms. So it was not a microdose for sure. But we have to look into that, whether a microdose would be different. It's very interesting to use a microdose. But I guess with a very high dose, we would have even stronger effects. That would be my guess. We did not test that.
Hi.
Hi.
I was wondering if you could elaborate a little bit more on how you're translating your coding, your cognitive bizarreness coding scheme into quantitation. So like in that figure where you had all of the LSD and ketamine and all that stuff.
So your question is how we coded it and how we translated it into a measurement.
Yes.
Well, the coding system goes like that. You identify the bizarre items in the reports and you count. And then you divide it by the number of words to kind of, if you have different lengths of reports, that might, confound the measurement. So you want to divide it by the number of words, and then you just count. So you have the intensity, the relative intensity in the reports. Yeah.
Thank you.
Nothing.
So when you block serotonin 2A, what about the other aspects of LSD? Are they impacted as well?
I did not understand.
So when you block your receptor, the 2A receptor, what about the other aspects of LSD? Are they impacted as well, or just the dreamlike state?
Yeah, that's a good question. Well, actually, I just presented the effects and the results from our sub-study, which are related to the dreamlike effects and guided mental imagery. There was another study done which has been published by Katrin Preller, and she has looked into neurobiological effects, mechanisms related to self-processing and meaning attribution. And these effects have also been completely blocked by ketamine. So it's the same or similar result.
And how do the patients feel? Like, do they feel anything from LSD when they have the blocker as well?
Actually, we used healthy volunteers, and they just reported that they felt a little bit more tired, but it did not show up. There was no difference between ketamine treatment and placebo in terms of the results. So that did not influence the results, but they reported that. Thank you.